Good morning and welcome to this week's SonoSim ultrasound webinar. I am your moderator, Heidi Winkowski, Vice President of Member Engagement, and today we'll be focusing on how DMS protocol assignments are accelerating sonographer training. Our team of expert sonographers will discuss how our DMS protocol assignments prepare students for entry into clinicals while saving instructors time and resources. All attendees will be in listen-only mode and may ask our panelists questions during and after the session in real time through the chat. A recorded version of this webinar will be available after our session. If you're just joining us, welcome. At this point, I'll introduce sonographer Deb Tracy, our DMS Program Development Advisor, to review SonoSim's newest DMS content and recommended strategies for integration into your ultrasound curriculum. Take it away, Deb.
Hi everyone, I'm Deb Tracy. I've been a sonographer over 40 years. My career includes being a clinical sonographer along with DMS clinical instructor and working in the commercial side of ultrasound. I'm currently SonoSim's DMS program advisor. Ultrasound is truly a passion of mine. As someone who has spent many years in various aspects of the field, I understand how important it is for sonographers to feel confident in their abilities, as well as know the resources educators need to help their learners develop this confidence and aptitude. The SonoSim DMS protocol assignments are tailored to both the needs of the learner in terms of engaging and efficient ultrasound training, as well as the needs of the instructor for ease of application in the learning environment. These assignments are specifically designed to reinforce a foundation of visual and manual scanning techniques. They provide the instructors with the opportunity to introduce scanning techniques early in the learner's academic experience, which ultimately prepares them as they enter in the clinical setting. The protocols provide clear and concise instruction for standardized imaging techniques, annotation, and the use of color and pulsed wave Doppler. Instructors can assess the learner's work in the Performance Tracker, SonoSim's interactive analytics interface. As you know, thermal ultrasound images will eventually fade or can be lost. The images saved in the Performance Tracker are always accessible to both learners and instructors. Individualized feedback can be created for each image and shared with the learners directly through the Performance Tracker. Learners have the opportunity to compare their previous images with more recent ones to note their progress and reflect on their technique, as well as build confidence through repeated scanning. This repeated performance of SonoSim's DMS protocol assignments allows for protocol memorization and extra practice time and increased dexterity. Because the assignments are mapped directly to IAC, AIUM, and ACR consensus guidelines, the learners can feel confident in their routine scanning while facing disparities between institutional protocols. These protocol assignments can easily be integrated into your curriculum. They can be assigned as precursor work, incorporated into lectures, or used during system wait times. For example, while some learners are using the ultrasound system, other learners can use the SonoSimulator to practice the DMS protocols. This means no downtime during the labs in the classroom, decreased necessity for a large number of ultrasound systems, and additional opportunities for the learners to practice eye-hand coordination prior to actual scanning. DMS protocols complement the anatomy and physiology modules, which are composed of online course didactics of organ systems and focused scanning objectives in each case. The DMS protocols build on this learning by expanding their scanning to comprehensive protocol imaging. To assist with successful integration into your program, SonoSim generates training roadmaps called Industry Recommendation Mapping, accessible via Performance Tracker. These downloadable documents show how SonoSim aligns with various ultrasound training recommendations. For DMS, we have mapped how SonoSim maps with KHEP's general, cardiac, and vascular concentration, as well as Sonography Canada's generalist competency profile. You can view which SonoSim modules and DMS protocol assignments align with each individual curricular requirement and use this information to easily implement SonoSim into a lesson plan. We will continue to release industry recommendation assignments and protocol for remaining concentrations. SonoSim will also be launching a new feature called Automated Assessment, powered by artificial intelligence, to assist instructors with image evaluation and grading. One major barrier to ultrasound curricular integration has been the resources required to standardize ultrasound competency assessments across many learners. However, with SonoSim's automated assessment, instructors can quickly evaluate the ultrasound competency of a large number of learners. The software quickly evaluates ultrasound images saved by learners, compares them to designated optimal images, and provides the instructor with a suggested score. This can save countless hours of assessment time and reduces subjectivity and grading. For more detailed information on automated assessments powered by AI, you can visit the webinar recording Leveraging SonoSim Performance Tracker for Ultrasound Curricular Integration on SonoSim's YouTube channel. Now I'd like to turn it over to Melissa Kang, a SonoSim Ultrasound Education and Program Manager, who will provide an overview of SonoSim's new DMS protocol assignments. Thank you.
Hello, everyone. My name is Melissa Kang, and I have been an ultrasound technologist for about 15 years, and I am thrilled to be involved in creating more DMS-focused content with SonoSim. We have added several new and exciting DMS protocols to our repertoire. Last year, we launched our DMS initiative with UIM protocols. Earlier this year, we released vascular protocols for extracranial cerebrovascular, upper extremity venous and arterial, and pre-dialysis vascular mapping. SonoSim's goal is to provide learners with a head start and more confidence as they enter real-world scanning. Our mission for supporting DMS education is to continue scanning protocol assignments for different specialties. Our latest release includes standard first trimester pregnancy, and we've begun breaking down the detailed first trimester protocols. We have also built upon our vascular content with lower extremity arterial and venous, abdominal aorta, and soon-to-be released renal artery protocols. All these new protocols provide concise instruction and virtual guidance, which are provided by subject matter experts. Learners can master their scanning technique in an interactive and immersive environment, while instructors can save on both time and resources and still ensure their classes are receiving ample scanning practice. So now let's go ahead and take a look at the new standard first trimester pregnancy protocol assignment to demonstrate how we prepare learners to acquire routine measurements by walking them step by step through protocols and giving them the repetition to build their confidence and knowledge. First, by assigning the advanced clinical first trimester pregnancy module, learners can walk through didactic instruction in the online course, which have practice questions, graded mastery tests, and utilize the module assignment to practice objective-based learning with the SonoSimulator scanning cases. These module assignments can be found in the performance tracker, which is here. After completing the modules, learners will have the foundational knowledge to work through complete protocol scanning. The DMS protocol assignment, which walks the learner step by step, can be found here. On the left, we have the protocol assignment, and on the right is the SonoSimulator. You can see the assignment sheet that we have listed out on the SonoSimulator features, which include freezing, calipers for measurements, annotation, image saving, which also saves calipers and measurements on the image and image review. Okay, so let's walk through the first few steps. Step 1, select a transvaginal window. Scan both axial and sagittal planes to evaluate the uterus, cervix, and annexa for the presence of a gestational sac. Step 2, enlarge the ultrasound image to ensure the gestational sac fills at least 2/3 of the image space available. Along a sagittal plane, acquire a single best grayscale image of the gestational sac. Annotate and fill in number and location for gestational sac and save. Step 3. Along a sagittal plane to acquire a single best grayscale image along the largest portion of the gestational sac. Obtain the length and height measurements of the gestational sac. Annotate gestational sac length, and here you would enter the measurement you obtained while using the caliper feature, height, and once again, enter the number that you obtained using the caliper feature and save. Step 4. Along an axial plane, acquire a single best grayscale image along the widest portion of the gestational sac. Obtain a width measurement of the gestational sac. Annotate gestational sac width. And here, once again, you would enter in the number you obtained using the calipers. Estimated gestational age, and here you enter the weeks and the days and hit save. Step 5. Scan both through axial and sagittal planes to evaluate the gestational sac for the presence or absence of the yolk sac. You would also document the size and shape of the yolk sac. Acquire a single best grayscale image displaying the yolk sac along the largest portion. Annotate yolk sac and either absent or present, the size and shape, and save. So that's just an idea of how it looks and works going through the protocol assignment. At the end of the assignment, the learners will have saved 36 images. We have the AIU and protocols linked up here, and you can see that we have essentially done the work for you by pulling out the necessary information and presenting to the learner in a condensed and clear format. Each learner uses the same patience, allowing instructions to have a standardized approach to teaching and assessing. Plus, at the end of this assignment, each user will have images saved that they can review at any time and that can be graded by the instructor. Within the performance tracker, you can then review an entire class performance all at once. As a student, access to transvaginal imaging is scarce. And if you happen to have a phantom available, you would just scan the same thing over and over again. It's also something as students we really don't practice on each other. And you do not get the multitude of B scans of normal and abnormal with traditional phantoms or simulations. When learners are presented with opportunities to scan, time is limited. With SonoSim DMS protocol assignments, learners can get repeated access to real patient cases with guided instruction and Doppler. Vascular scanning is presented with similar barriers. This year, we've added in lower extremity venous and arterial and abdominal aorta protocols. Extremities are easy enough to scan, and you can even practice on yourself, but there's typically not a lot of time spent on them. Using these vascular protocols means being able to scan without sacrificing instructional time and making it less scary for learners in the real world. The exposure and ability to learn at their own pace in a stress-free environment will build their confidence as they go into their first scans. Plus, there are certain parts of the body that we practice really quickly because it's uncomfortable, and we rush through practicing and getting those imaging windows, but that is a missed opportunity to learn the anatomy. For example, there are a few bifurcations you need to scan in the groin, specifically going from iliacs to common femoral to profunda femoris, and it's a little in an uncomfortable area when you're beginning. However, with the simulated protocol assignment, you can take your time. This means the ability to better appreciate the differences in the behaviors of the structures of veins and arteries during compression and color Doppler, as well as wall thickness, velocities, and anatomy. For abdominal scanning, while it's seemingly a simple exam, the accuracy of these images and measurements are critical. Our corresponding protocol assignments really helps hone those skills needed to master such accuracy, which is really important when dealing with situations like an aortic aneurysm. Our other upcoming releases focus on more specialized examinations. In regards to our renal arteries protocols, I can say I never scanned renal arteries in school. We learned about it, and during general abdominal scanning, we focused on the kidney or aorta, but never really on the renal arteries. Where we were told it's difficult to scan, so it's often misconstrued that it can't be visualized. But with practice, you know what to look for. And with these protocols, that's exactly what the learner will learn, and it will create the confidence to scan much more specialized exam and that other learners have not practiced. This is the kind of specialized instructions that can make a difference between getting a job and not getting a job. This is the reason we also chose to integrate detailed first trimester pregnancy protocols into our DMS assignments. If you know your normals, you're already ahead of the game. With improvements in technology, it's always important to stay ahead of the curve in practice. SonoSim will continue to produce these DMS protocol assignments to continue complementing and reinforcing your DMS programs. At this time, I'm going to hand it back to Deb to close us out.